I'm very happy to introduce food coach Lori Corbin, a nutrition and fitness reporter from ABC 7 Eyewitness News, and Dr. Zhaoping Li, director of the UCLA Center for Human Nutrition. Please welcome these wonderful women.
Everybody. It's so nice to be here, and I am not going to talk much about anything other than launching it to Dr. Li, because I know all of you know about the mind-gut connection, and it's so important. Probably all of you, raise your hand if you're taking probiotic. Anyone taking probiotic? Yeah. Okay, so Dr. Li has some things to say about that, so I just want to toss it right over to her, because she's the one with all the knowledge. So.
That's all the pressure.
That's how that works, right?
Okay, all right.
So Dr. Li, first of all, I want to know a little bit about your passion. You started in cardiovascular
research,
yeah.
Correct. And when I went to medical school, my passion is to deal with the cardiovascular disease that's been the #1 killer for humankind. And then I also pursued PhD to study the mechanism of cardiovascular disease. However, with the experience of learning and research and life experience, I realized when you get to the time to see a cardiologist, it is kind of far down the game. Yeah. This is a disease can be completely prevented or have better outcomes if we taking good care of ourselves, living a better life, have a better diet through life. And that is the reason I moved upstream. Instead of becoming a cardiologist, I practice nutrition as a physician.
Yeah, so 30 years in clinical research and practice.
Yep.
And so let's go on to that. We all know this when we get really nervous. We get that butterfly in our tummy, or we're getting ready to go on. Maybe you have that yourself, little tightness in your stomach. So there's a mind-gut connection. So what our gut is feeling, it's basically coming from up here. Is that accurate?
Yes, our gut, like our skin, are the best connection we have with our environment. And that, with that have said, our brain are so connected with the gut through the classic nerves, but also through hormones. Now we also know in the last 5-10 years, through the microbiota, those microbes we cannot see, but they live inside our gut. So it is so tightly connection both ways. Our mind controls how our intestine works. On the other hand, what is going on? What our gastrointestinal tract really senses the food come in, impact on our mood and how our brain feels.
Yeah, and the microbiome is what she was just saying. That's one of those scary sounding words. Basically, it means...
Okay, with advance of technology, right? We actually now know our body is not just human cells. There are all those nice neighbors stay on top of our skin and also inside our gut. They have been neighbors since the minute we came to this world. They've been an essential part of our life. If we're talking about how many of them, about 100 to 300 trillion of them. Right? If that gives you absolutely no idea what's the concept, each one of us carries about 4 to 5 pounds of them without really seeing them with our own eyes. They are essentially the intermediary between our body and the environment. And they can really process what we eat and become other molecules, or actually by their interaction with our body, our immune system, our nerve system, to impact on our entire body function. So they're little creature wonders.
So all of the things that we think that may be some other part of our body's problem, like an allergy or an anxiety or a depression or a chronic fatigue or just regular fatigue, right? Can you feed the microbiome? Is that part of a solution?
Yes, absolutely. We are truly in control what kind of bacteria, what kind of microbes live in us. By one thing, control what they got be fed. So every bite we take is not just for our own human cells. We are also controlling those microbes in turn have an impact on our overall health.
So what did you have for breakfast? Did you look out? So we do know brain health through food, and I would
Yes.
love for you to give examples of some of the primo, the really good, hard-hitting gut brain health foods.
Right, I'll give you one example, right? We all know one of the neurotransmitters called serotonins that really impact on our mood. Now we actually have pretty good scientific evidence to show your blood levels have a lot to do with what kind of gut bacteria you have in your gut. And you just asked me a very tough question, that is, well, how can I really know what kind of bacteria I have? Is that good for my mental health? Is there any superfood for it? And I think the answer is not that straightforward, as science is definitely moving along. With that have said, and through what we learned through evolution, and plant-based diet, diverse diet, definitely sets the foundation how we should take care of our microbiota.
And then, of course, that all-important question that I asked you earlier, are you taking a probiotic? Do you know about prebiotics? And this is interesting, because we had a conversation a little earlier, and you weren't so quick to the draw on a supplement on probiotics. So explain what you mean.
Yeah, so-called probiotics, for those of you taking them, they are live bacteria, and that can be existing in a yogurt, or for those of you taking as a capsules. So they are live bacteria. If you look at the label, it says 50 billion. Wow, big number, right? But that actually is not so big, considering we have 100 trillion or 300 trillion of them inside our body, on top of our body. The other thing is that the best probiotic today have about 3 to 5 different kinds. So just talking about how many different kinds in our gut, how about at least 500 different kinds? Yeah. So it is really not the time we can say, like we give you antibiotic for pneumonia or for urinary tract infection. No, not there yet. And we know now for sure, the most important come to our gut health, microbiota-wise, number one, diversity measure, actually come out measure number one. The more diversity we have, the best we have. The second criteria is how resilient they are. If you stressed out today, and you have butterfly like me right now, and they have really resisted to those stress. So we don't really know which particular one is the most important. Prebiotics, on the other hand, are not live bacteria, are the food for bacteria. What are those? Under the fancy word of prebiotics, that is what we're feeding our gut bacteria. That is the food we eat. The best for them are plant-based vegetables and fruit, and because those are the ones not only feeding us during evolution, but also those bacteria.
It's the kind of thing you didn't really want to hear, right? Right, diversity, she wasn't talking about packaged food. You're talking about all that plant color of the rainbow kind of thing, right?
Right, we used to think that those are waste. Actually, no longer waste. They are meant to get to the gut, particularly lower part of the gut, to feed your wonderful neighbors or those little creatures.
Okay, yeah. So the bottom line, the 2 or 3 things, you've just mentioned those plant-based foods. Maybe talk about our fats, our oils, and any other type of nutrition or mental health that someone needs to.
Right. I actually just summarize with the acronym of UCLA, right? First, talking about U. What U stand for, you really is trying to get as much as vegetables and fruit as possible. Unlimited for most of people, because on average, we take less than 2 servings of vegetables a day. Iceberg lettuce does not count, all right? Potatoes is a starch, not vegetable, right? Ketchup barely make it because the benefit of potatoes. So the goal is really to take at least 3 servings vegetables, the more the better. And fruit, we should take 2 or 3 servings. So that is the first U. And C, it is represent for we should be responsible and really have controlled amount of refined carbohydrates, that including the sugars. So it's not true we cannot have any of them. We do need them as energies. That's a C. L, it is actually lean proteins. That can be, seafood, chicken breast, turkey breast, eggs, and some of you use protein powders. Some of you use like vegetarian-based mixed proteins. They're all in that category, lean protein. A is equally important. It means activity. If you just passively put nutrients through your body, that is one story. You do need a driver, the activity to drive your body actively, take advantage of all those nutrients so they can benefit you and become part of you.
Dr. Li just made it incredibly simple. Doctor, thank you so much.
All right, thank you.
Very good.
Okay.